So why are men so dumb? Well, they're not. But what is the question I'm trying to ask? The question is, why are men so bad at dealing with their own health issues? Why do they wait until they have a heart attack? It's a good question. And the answer I have is that men traditionally are seen as the protectors. And in order to do that, you got to be strong. I'm never weak, ever, never weak. Just because you're strong mentally does not mean the body is different. All of our bodies are fairly similar in chemistry and in makeup. And if you're eating too much meat, too much sugar, you're not working out. Or maybe you're working out too hard. You think you're still 20 and you're working out and you're 45 and you're working out too hard and you're straining muscles and ripping tendons, and now you can't work out because your arm doesn't work. Maybe you're partying like you were 20 and the world never ends. I'm gonna live forever. Well, you're not gonna live forever. Aww. But you can live a long, healthy life that's very enjoyable. Let's talk about the over-reliance on being tough. Toughness is awesome. I mean, it's a skill set that allows us to survive as a species, whether you're men or women. I believe these skill sets are very pertinent, but as we're seeing as a society, it's tearing us up. It's not just tearing society up, it's also tearing up the individuals inside. I treat a lot of veterans and I treat a lot of people that have been through a lot of different things. A lot of the reasons why we don't change is we hide from our situation. We feel like we're almost ashamed that we can't deal with it, that we can't deal with that barometric change. It's like, wait, I was able to deal with all this crazy crap that I went through, and now I can't deal with this simple thing. Like, life is easy there. Why can't I deal with it? That machoism is touted in our society. It's really cool. But when it comes down to it, a lot of times those people are hurting inside. What we're seeing in our society right now and what we're seeing and really gravitating towards is a balance, having a balance. So it's okay to go up here, but then eventually we got to come back down and then maybe equilibrium in the middle. And that allows our body to be healthy, our mind to be healthy, our emotions and our spirit to be healthy. How do we support our loved ones on this health journey? One of the things I've encountered a lot of times is when patients come in, usually women, and they have a health concern. And then as we're going through it, maybe some of their questions are answered just in the initial exam, or we start to get some results and they start to feel better. And the next thing I hear is, wow, I got to get my husband in here. Sometimes it's the husband saying, oh, I got to get my wife in here, or their spouse. It doesn't matter. Sometimes, you know. And what happens is then they're like, oh, well, they're kind of reluctant. And as they start seeing some change in their wife or their husband or their significant other, they're like, wow, yeah, maybe that could have worked for me too. I think a lot of times though, the supporting of another means you have to be super strong. When you're supporting that person, you have to be rigid, right? I mean, a weak noodle doesn't support anything. As that person becomes stronger, so the patient is feeling better, let's say, they have to take on somewhat of a support role for the other person and say to themselves, look, you supported me, I'm gonna support you. And I've had patients do that. They sit right across from me here, you know, in the consultation room, and they say to their significant other, like, you helped me, it's time for me to help you. What is the new tough? So the new sexy tough is not, I hold on to my pain. It's not, I hold on to my trials and tribulations, but it's, I share them with the world. When it comes to your healthcare, you don't have to look at the old paradigms. There's new paradigms. And the new paradigms say you can be awesome, you can be macho, but you can also show a little vulnerability, because that's strong. That's hard to do. And when you do hard stuff, that's macho. And so being able to show a little vulnerability, to allow yourself that shift, and then you can start on a new path. It's your new journey. And the whole world's open to your eyes. You're like, whoa, man. You look at a new child inside, and it allows yourself to see the world differently, your health shifts, and all of a sudden you're like, wow, this is amazing, I didn't even know it. I had a 97-year-old lady tell me this. She's on her testimonials, and she was stuck in her house with back pain. In a few sessions, she was like, wow, you have changed my life. Now imagine somebody in their 90s telling you that. That's crazy, it blew my mind. She feels so much better now, loving life, brand new person. I think that's amazing, and that's what we're here to do. never too late. It's never too late to make a change in your life in anything you're doing, whether it's a relationship, job you don't like, maybe it's friends, you want to go meet some new people, maybe it's your health. That's what we're here for. So if it's your health, we're the place to come. We're going to help you. And the thing is, this idea that, I don't know, I've had this for 30 years, it's never going to go away. It may not, but it may. And what if it did just a little bit, to the point where you're like, I don't have to think about this all the time. Imagine having to think about pain all the time. If you're one of those people, you don't have to do that anymore.